I'm happy to be here today with Isabelle de Cremoux. Are you the CEO of the venture? A Paris-based, headquartered venture capital fund. And important for our conversation today, one that is focused primarily or has a major focus on the microbiome. So welcome. To focus in an area, a new area like the microbiome is I would almost call it brave, because you're at the tip of the spear of science in many ways. And I'm curious as to what you saw or what drove you to do this, to really build a fund around the microbiome, which has been incredibly successful.
Well, the company that I manage, so the venture partner, is a venture capital, and we have many funds. So one of them is indeed focused on the microbiome, but that's not the only fund that we have.
Of course.
And the job of a venture capital is really to identify in advance of the big companies, and probably in advance of most people, what will be the next wave of innovation, and where will small or medium companies could find a way through a life sciences market. And that's what we did when we identified a few years ago that the microbiome would be the new wave for this century. And in fact, the fact that there are microbes in and on our body is really not new. I mean, most of the ancestral medicines have looked at it, and the food industry, through the fermented food, know that for a long time. But what has really changed, and what was the inflection point, was when the cost of the sequencing decreased enough, and when the knowledge about bioinformatics increased enough, so that it became feasible at reasonable cost and reasonable speed to actually map a sample of human fluid, for example feces, and to know exactly how many of which microorganism they were inside. And it was funny to see that Nature magazines had a cover page in year 2000 on great, the scientists have fully sequenced the human genome. And absolutely exactly 10 years later, 2010, the same review made the cover page saying, great, the scientists have now fully sequenced the microbiome, the human gut microbiome. Yep. So to me, that is 2010 is the inflection point.
You've recently done a first close on your second microbiome focused fund. How's that going? And with the new fund, is there a change of focus or a change of direction? Anything you want to update us on?
Yeah, actually the fundraising of second fund has been much quicker and much easier than the first.
Funny how that works.
4 years ago, when we raised the first microbiome-focused fund, so that's for Life Capital 1,
yes.
When I met future LPs, the first half part of the meeting was to explain what was microbiome, why it was interesting. Now, 4 years later, I even receive spontaneous calls from LP that knock at the door and saying, we have decided to invest in microbiome fund. Are you fundraising? It really changed the landscape.
Well, the landscape has changed. I mean, definitely to your advantage, and you were, a leader, kind of out in front. I guess from your perspective as the leading microbiome-focused fund, and there are a handful I can point to that invest in the space, but none with the focus and the scale that you guys do. What do you see as the most attractive areas right now in the microbiome for making investments?
There are many fields depending at what you're looking for.
Right.
If you're looking for shorter term or lower hanging fruits, or whether you're looking for a very high reward and have a little bit more patience toward highest reward. So in the lower hanging fruit, I think FMT companies have made great progress. It all started with the C. diff indications, but now FMT companies are addressing at clinical stage in human many different indications which have great potential and are really, really close to the market. And if you look for the highest reward and have a little bit more patience, I think responder, non-responder stratifications, patient in cancer, and let's can dream about changing the non-responder into responder through gut modulators.
That's a huge opportunity.
That's a huge opportunity.
Longer term, though, and you invest across both
Yeah,
those areas.
Yeah, we
so.
diversify the timing and the level of risk of our portfolio choices.
Super. So with your new fund, have you made any investments with the first close?
Yeah, we have already made 2 new investments. One is in Axial Therapeutics in Boston, developing small molecules in the gut-brain axis, starting with Parkinson's disease and autism on Sarkis-Masmanian network. And the second one is in Denmark. It's called Galecto Biotech. It works on fibrosis disease, targeting galectin-3, new and fascinating target, with the first product targeting lung, and then a few other products in development.
Well, Isabelle, thank you. It's so good to catch up with you and to get an update on your fund. Congratulations.
Thank you again.